Hi everyone, I'm the head of marketing for Europe. You can call me Tomas and I welcome you to this training module. The aim of this training is to better understand the philosophy of setting objectives and key performance indicators for various marketing activities. We believe that building return on investment mindset, selecting those activities which prove themselves to be more efficient than the others, is the right way to build our business in a sustainable and profitable way. This module has been developed by the marketing team of Region Europe together with Milan Center of Excellence for Creative and Design in India. In Milan Region Europe, we aspire to be a learning organization. For instance, learning about achieved effects versus plans. Learning what can bring us closer to more efficient increase of shareholder value by maximizing return on investments. Paying special focus to outcomes of marketing activities can be one pillar that supports that approach. We apply various types of marketing activities to deliver the desired message to our customers. Most of the messages address one or more dimensions related to the product, brand, company, or service perception. For simplicity, let's call it a brand. In a nutshell, those dimensions fall most often into three categories: rational, emotional, and financial. It is worth remembering as well that various customers may have different personal preferences towards each category. Crafting the message and its elements is as vital as thinking about its possible and expected impact. Therefore, when you start to set objectives for a marketing activity and message dissemination, please adhere to the 3B concept. The marketing activity and delivered message shall affect beliefs, behaviors, and finally, business. Applying that concept to activity objectives is also essential for key performance indicator setting, the so-called KPIs that shall measure and prove achievements of your planned beliefs, behaviors, and business targets. KPIs equal 3B's objective measurements. Let's talk about the first B, belief. Making someone a deep believer is usually not a matter of a message, but a single and isolated impact. Therefore, we do have in place the customer journey concept or the customer adaptation ladder. The first step of our marketing message should turn a customer who is unaware about our brand into one who is aware. Aware customers may become interested in a story they have received. Later, usually after getting more personal experiences, customers believe that the solution that we offered is satisfying their needs. Some of them may become spontaneous advocates and strong supporters, recommending solution in scope, for example, to their peers and colleagues. This stage is also the beginning of the behaviors category. So, when crafting a marketing activity objective, we may start to phrase it in the way: marketing activity X shall make certain groups of customers aware or interested or who believe. Now, let's discuss the second B, behavior. After impacting customer beliefs, we would also expect a change within behaviors of customers which would increase demand for our products, brands, or services. For instance, in case of a behavior related to issuing prescriptions or giving advice to the patients, physicians may try: start to use regularly, increase new patient enrollments, increase usage frequency, increase usage duration, maintain usage, or be our advocate, and more, depending on the market situation. Pharmacists, for example, are to a large extent considered advice givers on top of simple product distribution. We may expect that a pharmacist recommends our brand when they see a consumer seeking solutions for a health problem. Substitution is a form of recommendation as well. So, Increase in recommendations or increase of substitution is quite often the objective of a marketing activity. An in-depth insight is required once we plan direct-to-consumer advertisements. By using various communication channels such as digital, outdoor, print, TV or radio, marketers may impact beliefs and behaviors of consumers as well. There are many options, both active and reactive. Some common examples are: the consumer is more eager to accept the pharmacist's recommendation or substitution. The consumer is asking the pharmacist and willing to purchase. The consumer selects and buys the product for him or herself. As a summary and example, the second part of marketing activity objective, we may phrase it in the way: marketing activity X shall make a certain group of customers to try, ask, buy, or use, recommend, buy regularly, or increase usage and recommendation, or sometimes maintain current habits. And now for the third B, business. When setting the objective of a marketing activity, we shall think from a business perspective. What could be the return on investment? How beliefs and behaviors of customers will translate into shareholder value? For this part of the objective, we may need some historical data, previous experience, prices and costs of goods sold. We will build it using our best assumptions as well. Coming up, Excel tables will give you an example on how to set and follow up with the KPIs objective according to the 3Bs concept, and how to estimate the return on investment. For instance, we plan to make a few standalone symposia to advertise the benefits of using Dymista for patients having uncontrolled allergic rhinitis. We plan to involve 500 GPs. That activity will cost €50,000. Majority of the participating GPs will actively participate and, in result, believe in scientific argumentation. Almost all of them treat these types of patients on a regular basis. Because of our symposium, they will start to use Dymista for that group of patients. This behavior will generate incremental amounts of prescriptions and result in incremental amounts of sold packs. Knowing these elements, product prices, discounts and cost of goods, we can estimate the measurable business objectives and outcomes. We may also set KPIs to verify if we are meeting our objectives. We invited 500 GPs for the symposia. We assumed that 60% of them will believe in scientific argumentation, and we will set a Net Promoter Score survey on the spot as a KPI to verify that assumption. We assumed 70% of them will remember the symposium conclusion once they are back at their practice and apply those learnings in their prescription habits. Our field force will verify it during their visits and report to CRM as KPI. Knowing epidemiological data and number of patients visiting GPs, we estimate that each GP will be able to prescribe incrementally at least 10 packs of Dymista per month. That also may be verified by the field force and reported in CRM as KPI. We will also track sell-in and sell-out data to observe sales trends. Inserting other data about prices, discounts, costs of goods sold, and cost of symposia. For instance, during the event or for an assumed period of 6 months after the event, we can calculate the return on investment. Here it is, 1.21. Each euro we spent brought us a net profit of 1.21 euros. Thank you for your participation in the training session. We do expect that you apply this knowledge while crafting your tactical plans. Setting outcome-focused objectives for marketing activities. Key performance indicators and return on investment mindset will allow us to reach even higher levels in marketing management. Thank you for your time. Goodbye.